Our next speaker is Dr. Raul Morales-Borges. Raul Morales-Borges completed his bachelor degree in general sciences with a major in pre-medical science and a minor in biology and sociology at the University of Puerto Rico in 1985, and his medical doctoral degree in San Juan Bautista School of Medicine in 1990. He performed his residency in internal medicine at Henry Ford Hospital in 1993 and a fellowship in hematology and oncology at Providence Hospital at the University of Michigan Medical Center in 1995. He got his certificate in CGMP, Clinical Research, Theology, and Biblical Hebrew. He obtained a diploma in business management from International Business Management Institute in July 2018. He has been the medical director for the American Red Cross in San Juan, Puerto Rico from 2010 to 2016. He served as a director of clinical laboratory improvement amendments, director of the hematopoietic stem cells transplantation and cellular therapy program and immunotherapy reference in laboratory at ARC in PR, Puerto Rico. He is the Chief Medical Officer of ASHFORD Institute of Hematology and Oncology since 1995, faculty member of Medicine Department of the ASHFORD Presbyterian Community Hospital. He is the president and principal investigator of New Alliance Integrative Research and the president of medical director of Integrative Optimal Health of Puerto Rico. He also joined the BRCP Global and Summer 2020 as the principal investigator and medical liaison of the Puerto Rico unit. He serves as a clinical instructor for students at naturopathic medicine doctor program at Sistema Educativo Ana Geméndez since 2015. He has publication as well as participant as a reviewer in peer-reviewed medical journals. He worked as a collaborator as well as a principal investigator in clinical trials. He has experience as a lecturer, as an educator with the School of Medicine, pharmaceutical companies, and other institutions. He completed a certification in bariatric medicine and wound care by Wound Care Education Partners under the C and Hyperbaric Medical Society as well as brain health. 2 more points. He's my friend. He helped with my brother at the later days when he passed away. And he also helped me save patients in the same hospital. We worked together. Welcome, Dr. Morales-Borges, my friend and a healer.
Wow, a lot of things. Well, I'm going to give air. I'm going to give oxygen because you guys are tired. Having hair all day, so I'm going to provide some HBOT. Now, we're going to imagine like we're in a chamber, so relax. I'm going to deep breath, another deep breath, do 3 breath. I'm going to take oxygen, okay, for your brain, at your mitochondria. All right. So I'm going to talk about hyperbaric medicine. You say, what? A hematologist, oncologist talking about this? So do you know what? I've been a hematologist, oncologist for 28 years, and I joined integrative medicine and nutritional medicine by 2014 because the patients enforced me. Doctor, what about vitamin C? Can I take that herbs? So then I said, you know what? Instead of saying them no, let's go and join them and look about what's going on. That's one of the reason I studied a lot of nutritional medicine. And then I got involved lately, about oxygen. And that's where I got interested also in hyperbaric medicine. So let's start a little bit about definition on what's going on? Our hyperbaric medicine, okay? Hyperbaric medicine, hyper comes high, baric as a pressure and oxygen. That's the more for the terminology. It's a technique that we use 100% oxygen in the chamber, okay, at a pressure of 1 atmosphere. Usually we're using 2.4, 2.5. But usually that's the reason, and it's gonna help in many things. And we know that initially we use for decompression syndrome and people who are doing scuba diving. And we're also using that on wound care and burns, also myelitis. But we now will talk here about other two options that we have for anti-aging, and I'm going to provide information of the use of hyperbaric medicine in cancer patients. Hyperbaric, as I said, is increased. Baric is pressure, is both. The intermittent, usually daily, that's where they will do that, of 100% at the atmosphere of 1 or 2 or 2.4. The community on hyperbaric medicine defined that this is the mode of medical treatment on which the patients being closed in the pressure chamber, okay? And we use the ATM, which is the atmosphere equal to 760 on the pressure. This is the initial one, chambers, okay? We're gonna talk a little bit of story. I don't want you guys to go to fall asleep, but I want to talk a little bit of story to know that we know that for a long time. Since 1662, with Henshaw, there's a Henshaw principle. Also in 1775, in English, which is Joseph Priestley, was the first one to discover the oxygen. And we have Anthony Lavoisier in 1777, who used the name of oxygen. We have a lot of people going in this. I don't want to talk about, I don't want you to make a historian. So, but I really want to know that this is very well known for years and years, okay? Since 1970s, most of the instructions, courses, research, work area, and guidance have been provided under C and Hyperbaric Medicine Society. And they are the headquarters in Maryland. I'm a member of them. So we have that under pressure. I don't want to talk about the physics, but remember the Henry's law of gas behavior, the Fick's law of gas behavior, and the Boyle's law. Okay? I just want to mention that. So important is about what are the physiological and biochemical effects of hyperoxia. Suppression of the alpha toxin production by Clostridium perfluoride, improve leukocyte killing activity, promotion of fibroblasts is good at wound healing, vasoconstriction in normal blood vessels, decrease post-traumatic tissue edema, reduce half-life of carboxyhemoglobin, improve dissociation of carboxyl monoxide. So that's the principles of them. How are the dosage? The dosage is 100%. The chamber is 100%. Okay? The pressure are variable and mostly use 2.4 atmospheres is the most common one that we use. Okay? And 4 atmospheres, never use that. It's going to cause seizures. All right? I don't think you never go to 3. Stay on 2.4 is the maximum. Okay? Compression, 10 minutes. Remember, I'll tell the patient, if you go like a swimming pool or you go to the beach and you go to do diving, so you're going to feel some pressure in the ears, all right? So you have to tell the patient to do that because it's important to have the patient to know what's going to be, all right? So that most of us have that experience when we go to the beach or to the pool, that's right? So they have to provide time for compression, usually 10 minutes, and then the compression, 10 minutes, and the time that whatever the doctor is going to prescribe. Because maybe most of the treatment, the minimum time is 30 minutes, but you have to account 10 minutes to go to compression, 30 minutes on treatment, and 10 minutes toward decompression. So this is going to be almost 50 minutes as a minimum, all right? So that's important that the patient allowed to learn and know what's going on, and they don't get afraid about that, okay? So the diets are between 30 and 120 minutes maximum. And usually daily, or sometimes people who are very sick, we provide twice a day. But daily is enough. The total number of varies on the indication, but usually it can be 20 or 30 dives. Okay. What are the indications? I'm going to talk about the indications and the contraindication and the relative contraindication, because many people say, no, I'm just going to do there. No, you have to know what are the issues about indications and what are the possible complications that could be, okay? So the most common one is air or gas embolism, okay? The clostridial myositis or myonecrosis, decompression sickness, enhancement of healing by other problems, diabetes, wound care, okay? That's the next one. Exertional blood loss anemia, unjuvenile weakness, intracranial abscess, delayed radiation injuries, people who are getting radiation therapy, thermal burns. Additional indication by the European consensus, they added surgery, implant, and irradiated tissue, sudden deafness, neuroblastoma stage 4, post-anoxic encephalopathy, and limb transplantation. What is no contraindication, absolute contraindication, is the use in patients with pneumothorax, untreated pneumothorax. Patients who have received intrapleural chest tube, all right, or thoracentesis, they're at risk of developing a pneumothorax. It is very important that when the patient comes in, because the patient is interested in hyperbaric medicine, it is very important to ask about the story of lung diseases or chest wall trauma. All right? It is very, very important because this is an absolute contraindication. It's a no-no. Relative contraindication. Concurrent use of chemotherapy. As an oncologist, you have to tell them, doctors, I want to be there. No, you cannot go because you have received doxorubicin, because you have received cisplatin, carboplatin, bleomycin. Bleomycin is very toxic for the lungs. So that is very important on the history. Doctor, I got past history of chemotherapy. How frequent, when was the last chemotherapy? Okay, that's very important. Okay. Disulfiram, they use cisplatin, as I mentioned before. Mafenide also is a relative contraindication. Chronic pulmonary disease, it depends. If it's inactive, if they're stable, you can go ahead. Always ask, as I said, your pneumologist. Ask for the clearance, okay? The same thing with asthma, implanted devices. So the patient who have epidural pain pumps, okay? And also people who are pregnancy, it's very important to request also the clearance by the obstetrician. High fever, active infections is a relative contraindication. Inability to be in the chamber, claustrophobia is very important, okay? If your patient has a history of claustrophobia, go ahead, hold it. Unless the patient can be used as sedative, okay? Some anxiolytics. And also a patient who have problem with the ears or prior ear surgery. It's a very difficult, it's very important to know that, okay? The claustrophobia, history of eye surgery, history of thoracic surgery, as I mentioned before, spontaneous pneumothorax, chronic or recurrent upper respiratory tract infections. So there are relative contraindications. That is very important. I have a long list, a checklist. When the patient said, okay, I want to go for hyperbaric chamber, you have to do a good history. So it's very good if you're going to refer a patient, be sure you know that the absolute contraindication and the relative contraindication before you refer a patient for hyperbaric chamber. Okay, let's go to talk about anti-aging, all right? Important about the aging process and the deficiency, okay? We know that the stem cell therapy and young plasma transfusion, physical exercise, intermittent fasting, So those are treatment that we are already been talking about that, okay? But here, stem cell transplantation and young plasma, as well also the therapeutics, sometimes have that potential in this case. Let's talk about the oxygen level and aging. Okay? In terms of aging, the truth is not a duality when it comes to the trade-off between hypoxia and hyperoxia, specifically when the issues are in the oxidative stress. The first large deviation from normoxia, to contrary, includes also the modulation of the oxygen, and also we'll have to be sure check about that. Okay, so this is a graphic about hyperbaric chamber, how to use that in the healthy aging. It's very important because it reduces inflammation. Okay, improve the white cells, reduce the enhancement of the antioxidant effects, interferes also with debridement, increase the fibroblasts for the wound healing. And aging is very important to improve their cognition, inhibit intrinsic skin aging and photoaging, improving glucose metabolism, and improve the other type of metabolism. Some of the concerns about the use of hyperbaric medicine, but usually it's very rare about the side effects. They are very well tolerated, okay? To conclude previous finding, HBOT have provided valid and sufficient information on these protective effects against aging, with many remaining questions beginning to answer protocols to optimize. There are important discoveries yet to come, and also it's very important that have beneficial implications in aging. We're going to talk about it on cancer, okay? Cancer, remember, is the second cause of death, and hyperbaric oxygen has been a long time investigated, and with Dr. Michael Gonzalez group, we published a review papers, and that's what it's going to be most of my part of my presentation now. So we know that hypoxia influences the cancer growth, okay? The cancer cell doesn't like to be on the oxygen, so the oxygen kills them. So they want to be off the oxygen, all right? So hypoxia causes growth, angiogenesis, and then differentiation. And that allows to go to tumor progression. So it is very important, the basic principle for cancer and oxygen. So there's enough research that show that hyperbaric oxygen can be inhibitory and reduce the cancer growth in some cancer types, and very good in breast cancer. I had a patient already started treatment, have a big tumor in the breast, and also have a pleural effusion. I haven't had it before, any chest tube or any drainage, and the patient improved. But we just did some 2 or 3 dives as a trial before start with the machine. The patient offered to start with me, and then the patient got sick and he had a pleural effusion tap, and the patient went to another site, and they said, "Doctor, they're going to give me a hyperbaric chamber." So remember, you have the chest tube placed, so you have to be sure, you have to be careful, okay? So I told her to already, it's a relative contraindication, okay? Also have been shown that patients with cervical cancer, bladder cancer, means that they are not very well responder. That's good to know. Bladder cancer and cervical cancer are not good responders to a hyperbaric chamber. In vitro studies have been shown that also there's other studies that support use of cancer. I show here some a study that has been published. Usually we have a combination with 5FU in patients with breast cancer, and has been shown that it's very effective. There's another hyperbaric chamber in combination with melatonin, very good in gastric cancer. It was published in 2018. Chemo and radiotherapy also is very good to the brain in combination with hyperbaric chamber. There's another study, hyperbaric chamber with head and neck cancer, has been published, information. Also, wound healing in patients who have ulcers for Kaspar and other tumors and cancer. There's another protocol that has been done with 100% oxygen at 2 atmosphere for 90 minutes, with, reported by Dr. Griffin in 2018, and that's been shown that it's very effective. Very few issues. Hyperbaric oxygen provides patient breathing pure oxygen under higher than normal pressure. Application hyperbaric medicine mainly occur management setting in the treatment of radiation treatment complication. So it's very good in people who have radiation burns that you can provide that hyperbaric medicine. Okay? What about the combinations? There are few studies that demonstrated that you can do hyperbaric therapy with vitamin C. That's a good combination. It's already, you can do that, check the literature. Also, hyperbaric oxygen therapy with glutathione is very good as an antioxidant and been shown in different publications. What about hyperbaric oxygen versus ozone? How many people are using ozone here? No? Okay. So ozone therapy and hyperbaric oxygen are not the same. That's very good to know. All right? The one that you have to see here, the upper part is the chamber that I use, the vertical one. The people are seated in the chair, feel comfortable. Okay? The main difference between the two is that ozone therapy is working to remove the toxin to create a more clear flow of oxygen to your cells and also the tissue, while hyperbaric oxygen therapy directly exposes the tissue and all the cells to pure oxygen at 100%, and is inhaled and goes directly to all the cells and tissues that your body needs. Okay? A study has shown that hyperbaric oxygen therapy is more effective than ozone therapy for antibacterial effects. So that is the big difference for ozone versus hyperbaric oxygen. There's one study in Poland with 114 patients with venous stasis ulcer that has been shown that is very effective, hyperbaric oxygen. Treatment procedures also are being presented every day, except for Saturdays and Sunday, 15 minutes. And the duration of the single treatment was 30 minutes. The cause of statistic, the reduction of the ulcer was very good, very safety. This is a table that has been shown that what are the benefits in different indications between ozone and hyperbaric chamber. So hyperbaric chamber is crucial in anti-aging and cancer medicine as well. The classical indication as discussed here decreases inflammation and enhances detoxification, improve skin health, accelerated wound care, improve cognitive function, increase energy level, improve the immune system, enhance physical performance, improve response to treatment, and improve survival and quality of life in cancer patients. So I made a very short conference, so you have any questions? And this is my website page. Thank you. Oh. Quick question though.
Oh, okay. Have you heard about any patient developing tinnitus after hyperbaric chamber oxygen therapy? Tinnitus, ringing on the ear.
Oh, yes. I read about a literature that can have some tinnitus.
Is that normal that occurs? The patient should not be exposed again if
Yes,
developed?
but the recommendation is if they have the first sign, the second treatment should be delayed or postponed.
Okay,
Yes.
thank you.
You mentioned vitamin C, glutathione. Another one.
Oh, sí,
Got it? That's right. You mentioned vitamin C, glutathione, and the treatment.
Yes.
You do it before the treatment of hyperbaric, during the treatment of the
The
hyperbaric.
recommendation has,
After.
according to what I read, they're recommended to do high dose vitamin C or glutathione prior to getting the chamber.
Perfect.
Yes.
That's a good thought.
All right. Thank you.